feel free to post questions in the chat. We will certainly address everything, hopefully at the end, and give people a chance to really communicate. And we, just letting some more people into the, to the meeting. Okay. And then please turn off your video. This will help kind of get things moving, and then we can always stop and answer questions. And because there aren't that many of us, if I'm talking about something, then please feel free to jump in and ask a question. I'm happy to do that as we're doing this as well. So, all right. So this is kind of our agenda for tonight. We want to do welcome and introductions. We want to really thank you all for attending. It's really wonderful that you're here tonight. I personally am extremely excited about what's going on legislatively for PAs, both in Colorado and nationally. And I know that CAPA is also very excited. So we'll do a little bit of an overview of CAPA just to give you some perspective on who we are and what we're doing. And then also I wanted to do a review of the legislative history with CAPA because it's been long and very fruitful up till now. And then obviously I want to review the legislation that we put forth this year, which was House Bill 22-1095, and talk a little bit about future goals because there's a lot going on for our profession and there's a lot of things we'd like to accomplish. And then also talk about a little bit about the legislative process in Colorado, how that works and what our expectations could be moving forward. And then really talk about advocacy and what you could do and we can all do to really move the PA profession forward in our state. So that's what we're hoping to accomplish. And this seems to be fairly obvious, but who advocates for you at the state level? And that person is CAPA. Those people are CAPA. But I would also say that you advocate for yourselves at the state level. So advocacy is a really important tool. It's how we're going to get things done and get accomplished. So we'll talk a lot more about that as we sort of move through this profession. So a little bit about CAPA. CAPA is a Colorado. Oh yeah, sure. Go ahead, Cooper.
You just make sure I'm co-host so I can let people in while you're talking.
Oh yeah, of course.
That's my computer. I'm sorry.
No, that's fine. Let me just 1 second, please. Yeah, thanks, Cooper.
No worries.
Okay, you should be now.
All right, thank you.
Thank you. All right, so the Colorado Academy of Physician Assistants. I'll make one comment about title change right now. Currently in Colorado, we are still physician assistants. And the reason for that is we have not changed the title officially. So all of your contracts, all of your credentialing, everything that is sort of legal in Colorado right now, including state law, that really still says physician assistant. So that is definitely one of our priorities, and we will talk about that. So CAPA was established in 1976. We are a constituent chapter organization of the AAPA. We work very closely with the AAPA. It's been a wonderful relationship. We represent PAs in Colorado, and I checked a couple of weeks ago, and per the medical board, there's 4,100 and something PAs licensed in Colorado, and that number is growing. So it's wonderful. It's wonderful. So our mission is to advocate for and promote the PA profession by providing professional development, education, representation, and legislative advocacy for all PAs. And CAPA really does strive to represent all PAs. We have a huge survey going now that is out on social media. We're actively trying to collect data and information from PAs in our state so that we can really represent you to the absolute best of our ability. Our vision, CAPA believes in access to and delivery of quality medical care for all Coloradans and promotes a commitment to team-based care to enhance health and wellness of the people of Colorado. So while our mission is to support PAs, I believe that leads to the vision, because when you support PAs, you support quality care and you support all of the people and patients that we take care of. And so that really is the end goal. That's the end goal for what CAPA is doing. And that's definitely the end goal for this legislation, is to provide access and high quality, affordable care for Coloradans. So that's truly what we're trying to do in our small way, as best as we can, is really promote good healthcare. All right. So little history. I love this history. And as we're kind of going through this, I just will highlight a few things, and I want you to really think about how far our profession has come in these last 50, 60 years. So 1968, the Child Health Associate Legislation and Certification. So we are privileged in the state of Colorado to have one of the oldest and most respected PA programs, University of Colorado at CHAPA, started in 1968. So in 1976, that's when CAPA actually registered with the Colorado Secretary of State. So this organization has been around and been active for a long, long time. Really good history. 1983, PAs were certified in Colorado. So we're all PACs or PA students. You know you're going to be a PAC to work in Colorado. 1983 was when that was first happened. And it wasn't until 1987 that we were actually given the ability to write prescriptions for non-scheduled drugs, medications. 1992, that's the first time that hospital staff could take an order from a PA. So I want you to imagine working in your jobs right now and not being able to give orders or write orders. 1992, not that long ago. 1995, that was the first time that you could do scheduled prescribing in Colorado. 2002, we did some co-signature requirements that has since been removed from legislation and the rules for the Colorado Medical Board. 2005, they increased supervision, and then PAs were actually allowed to own 49% of a practice. So 2011, we were not allowed to write handicap placards until 2011. 2016, that was a big year. That was a Senate bill. So we were able to perform functions delegated by the MD, and that sort of defined our scope of practice. 2019, another big year. Probably some of you remember this. I was a part of this legislation. So this was House Bill 1095. Coincidentally, our bill this year has the same number. So, you know, we're hoping for a little bit of magic the second time on that number. Increased supervision from 4 to 8 PAs. We added an additional PA to the medical board. So we have 2 PAs on the Colorado Medical Board representing our profession. And we also uncoupled liability for physicians and PAs working together if the PA has been working for more than 3 years. So right now in Colorado, if you have been practicing for more than 3 years, your physician, who currently might be your supervising physician, is not liable for the care you provide. And I want to be very clear about that because I think that's something we hear a lot from the physicians, but we have already uncoupled that. So House Bill 1041, that was just a technical bill that we needed to add further language into a different part of the Medical Practice Act so that we could really maintain some of those current malpractice policies that PAs do have right now. So 2021, another big year. We really tried hard to put forth a bill that would remove supervision from Colorado statute. There's a lot of reasons that we did that, but we'll talk a little more about that in a minute. And what we wanted to do was replace that with a collaborative period for new graduates and those changing specialties. It also authorized direct pay for PAs. We have since been told that everyone here should know that direct pay was authorized at the federal level starting 1/1/22. Medicare approved that. And we've been told that that is already in place in Colorado. State law preempts federal law on this particular issue. So if this comes up again, we'll be revisiting that. This bill was heard in the Health and Insurance Committee and unfortunately did not pass. We had 5 votes for us and we had 8 votes against us. It was close. It was a long hearing. There was a lot of support and there was some very vocal and unfortunate opposition from certain physicians and physician groups. You are more than welcome to go listen to that. That is available. You can search for House Bill 21-1184. That testimony is public record. So if you want to go hear it, you certainly can. Just go to the Colorado Legislative site. Unfortunately, also last year, There was a pediatrician who's a representative, Representative Caraveo. She voted against this. And there's a nurse, Representative Mullica, who also voted against it. So we've been trying really hard over the past year to put time and effort and energy into education for people who don't understand what PAs really bring to the table, what they're really capable of, and why this is a really good bill. So this year, so exciting, so excited. House Bill 22-1095 got our good number back. This is a clean, simple, modest, wonderful bill. We worked really, really hard on this. We have an incredible team at CAPA, and we have some incredible PAs who've really contributed, not to mention the amazing work from the AAPA and also from our lobbyist, Diana Protopapa with Frontline Public Affairs. It's just been an amazing collaboration and teamwork, which is what PAs are all about. So this bill removes supervision from statute. It replaces it with a period of collaboration for new graduates of 3,000 hours and a period of collaboration for those of us who choose to work in a different specialty. And that's for an additional 2,000 hours. It removes some of that confusing language concerning hours of direct observation. For any of you who may have gone to a new practice, it's 80 hours if you're a new PA, and then 40 hours on site if you're an experienced PA. That language was really left over from the old Rule 400, and it's pretty confusing. So we're trying to really clean this up, make it very easy, just so that everybody understands what's going on. We have a hearing at the Health and Insurance Committee this Wednesday at 1:30. You are welcome to come if you can, use your own judgment as far as what's safe for you and your particular situation, but it would be wonderful. I will be there and many members of our team will be there. So that will be an incredible opportunity to see how this process works and show your support. And we are very hopeful that things will go our way this year.
Hey, Ellen, real
Yeah.
quick, how can they join that Health and Insurance Committee meeting?
Oh, yeah.
Are we going to
So-
send it out to everyone?
Yeah, we can send something out so that you know how to join.
Awesome.
But if you literally go to the Colorado Legislature website and search for the committee hearings, you can actually listen, and we'll send that out to CAPA members and post that on social media too. So you can actually go to the State House and be there in person, or you can listen through the website. So it's very easy to do that. Everything's public record. This is public access. It's amazing.
Do you think it would be okay to make a quick plug for health equity?
Sure.
Okay. Health equity is a big topic in the last year or so, maybe 2 years. So health equity, how would you define that, Alan?
Well, I think maybe we can talk about that as we talk a little bit more about what we're hoping to do with the bill.
Okay.
Yeah, because we're going to talk a little bit about sort of access and affordability, and
Okay.
yeah, so maybe we can do that.
I'll
Yeah,
plant seed right now and
Yeah.
think about if you practice in an area where you feel like you're providing health equity.
Yes.
Definitely consider maybe reaching out and testifying.
Yes. Yes.
Right?
Absolutely. Yeah. Yes.
Cool.
Yep. Yeah. Well, we will definitely circle back to that topic, Cooper. Thank you so much. Okay. So collaboration. I think it's worthwhile to define this so that everybody understands what we're talking about when we talk about collaboration in this bill language. So collaboration means the interaction. This is literally the bill language. Collaboration means the interaction and language that a PA has with at least one collaborating physician, in which the PA and the collaborating physician are cognizant of the PA's qualifications and limitations in caring for patients. The PA consults with the collaborating physician regarding patient care as appropriate. The collaborating physician gives direction and guidance to PA as appropriate. When I read this encompasses every single day and every single interaction that I've ever had in medicine. PAs are collaborative healthcare providers, just as nurses are collaborative healthcare providers and physicians are healthcare collaborative providers. So are respiratory therapists and physical therapists and occupational therapists and medical assistants and CNAs and x-ray technicians. Everyone that you can think of collaborates in medicine. That's the way it works. But so we just wanted to put this in there to define this so that people are really aware of what happens in PA world. And I think it's a really good definition. And it's also a definition that is present in other states that have passed OTP legislation. So this is really important. And I'll pause here just for a minute to explain optimal team practice, because I don't think we have that. We may, and if we have it later, I'll apologize now. So optimal team practice, that is a basic tenet of where we are trying to take our profession. And this is on the national level as well. And there's 3 parts to that. The first is removing this unnecessary one-to-one tether between one PA and one physician. We work in teams. This one-on-one tether just doesn't work anymore. We are also trying to have PA representation on the Colorado medical boards. Believe it or not, some of the medical boards that oversee and discipline PAs do not have PA representation. We have 2 PAs on our board in Colorado, so that's really wonderful. And the third tenet is really making sure that PAs have direct payment and that we are represented in the payment structures for reimbursement. So we've talked about collaboration. Now in this bill, collaboration, that we just defined, really only applies to new graduates and those changing specialties. So less than 3,000 hours, you have to have a collaborative plan, and this is developed at the practice level. It describes how collaboration will occur between a PA and the collaborating physician. It describes the methods for evaluation of competency, knowledge, skills, and how often you need to do the performance evaluation. This is best done at the practice level. Every practice is slightly different. There are different skill sets. There are different needs. So this is really just a written document that describes this. And CAPA did this in the past, and it's on our website. But we will have samples of this available so that you can take them to your practice, so you have some idea of what really should be in there. Experienced PAs, there's no legal tether, there's no legal collaboration, and there's no legal supervision. That doesn't change what happens at the practice level. You do not all of a sudden stop asking for help or start having conversations with your colleagues about what to do for certain patient populations. So it becomes more of just a workday occurrence and how you practice good, safe care. So you can demonstrate your experience through affidavit of experience if you come from another state, right? So if you come from Utah, say, and you have practiced for 4,000 hours, the board will have the ability to say, hey, I need you to prove that. You have a license in another state, or there's a license in Colorado before the changes take effect. Still, since 2019, PAs who have 3 years of experience have been required to carry your own professional liability insurance in the amount of no less than $1 million and $3 million. That is part of why we did that bill in 2020, to make sure that your rider policies or the other policies that you have in place do count and can still move forward. The only thing that we are changing as far as liability, and I want to be very clear about this because you're going to hear a lot of confusing information. The only thing that's changing with liability is we're moving it from 3 years to 3,000 hours. That's it. Nothing else. Okay. Experienced PAs. If you've been practicing for more than 3,000 hours, you shall, this is directly from the bill. Again, this is language. You shall have to consult with and refer to appropriate members of the PA's healthcare team based on a patient's condition, the PA's education, experience, and competencies, and the standard of care. That's where we are moving to. And that is what keeps us safe, ourselves and the standards of care. and your experiences and your competencies and your ability to know what you should and should not be doing. And again, the liability moves from 3 years to 3,000 hours. Okay. Future goals for right now. So this bill is very, very important. We are hearing from a lot of PAs that it's becoming increasingly difficult to find work in Colorado. And that is because PAs and NPs are basically interchangeable for the job that we do. And that's great. Their APRNs, or the NPs in this state, do not have any supervisory requirements. They have full practice authority. They have to have their medications co-signed for the first 750 hours after graduation, and then they don't have any ties with supervision. That makes them much easier to hire. They have proven themselves to be safe, effective providers. So that's just sort of an easy button for employers. We also want to increase access to care. There are many, many stories of PAs working in underserved areas with a physician. And we know if that physician leaves, as many, many have, then that PA loses their job also, unless they can find another physician to replace them. So we need to remove that tether and increase access to care. And we all know the PAs are affordable, safe, wonderful providers. What will not change? This bill will not change employers' ability to oversee or require additional oversight of employees. In some of the emergency rooms, PAs have to have every chart co-signed. That's not the law. That's that employer deciding that that's what they want to do. So we don't want to change that. Every practice is different. We want the employers to be able to implement whatever they think is safe in collaboration with the PA team to make sure that patients are treated effectively. PAs will continue to be held to the strict professional and ethical standards that we all live and just that's all what we all do. And we'll also still continue to be regulated by the state medical board. The Colorado Medical Board, they're charged with patient safety. That is what they do. So they will be able to have oversight of some of those things as well. And what this will not change is provider team practice. I can tell you in my practice right now, if we remove supervision, nothing would change. I would still have the same relationship with my team, the same relationship with the physician that I work with. It would all be the same. Okay. Legislative process. I just want to go through this so we understand where we are and what hopefully we'll be moving forward. So we are in the House of Introduction. So there's two houses in Colorado, just like at the national level, there's the House and the Senate. We are in the House, we're in the House Health and Insurance Committee. And it's an appropriate committee for us to be hearing this bill. We have a committee hearing, as I said, next Wednesday. If we pass that committee hearing, we will move to a second reading in the House and then a third reading in the House. And if that all goes well, we will move to the second House, which is the Senate, and go through a similar process. So I don't know if you all remember Schoolhouse Rock, but I'm just a Bill. That's that picture, that little guy right there. So, and he's got his little hands outside of a committee session. That's what we'll be doing next Wednesday for sure. So if that all goes well and it gets through the House and it gets through the Senate, then it goes to the governor for action. Governor Polis is incredibly supportive of PAs. He's incredibly supportive of access and affordable healthcare. So we really do believe that if it gets to him, this will be signed and become law, which will be incredible. Okay, what can you do? What can Colorado PAs do? I truly believe that PAs are just connectors. We connect with our patients, we connect with our teams. That's just sort of built into us and our profession. And they do always say that all politics is local. Well, I really believe that all advocacy is personal. Everyone here is here for a reason. Something has happened in your life, or you feel very strongly about something, or this matters, right? And every single effort counts. If you email your legislator, or if you make one phone call, or you talk to one colleague, that can literally be the difference between this bill passing or not. So I would encourage you to really think about what this means to you, why you're here, and then get involved in any manner that you see fit for yourself, right? So join Kappa, stay a member of Kappa. There isn't some magical PA database out there that allows us to find you. We only get your information if you share it with us. The medical board has PAs listed, but they do not give out your email. They do not give out your phone number. So if you want to stay involved, please, join us. We'll get your email, you get on our email list, but we're also becoming extremely active on social media too. So talk to your colleagues. The most important thing that we need right now, today, in the next couple of days, is for you to contact your state legislator. If you click on this link, and maybe someone can post that link in the chat, or if you go to our webpage, it's right there. It's a great link. You click on it, you put in your name and address, and it automatically self-populates your legislators. There's a template, there's talking points. You can cut and paste, tell your story.
Yeah, and Erica just put it in the chat. So
thank you.
That is the link that you need to click on right now. And when we are done, do it. It takes less than 5 minutes. And it's so important. It is so important, right, Alan?
Oh, it's so important. And I it's
in the South Denver area in Arapahoe County, right?
Yep. So yeah, it literally takes 5 minutes. So it's just, legislators really care. They really care about the people they represent. And they really, really respond when people reach out to them and tell them their story. It makes a huge difference. They are representing us. It's like, if your patient calls you and tells you something, you respond to that because you care about them, you're taking care of them, you represent them in a certain way. So it's great. And I will also say that your state legislators are people just like you and me. They have other jobs. They are there because they care. They want to hear from you. They're very, very accessible, particularly in Colorado. We're a friendly state. To pick up the phone, call them, email. Please do that. And the templates are there. There's all sorts of talking points, but really tell your story. Go back to that why. Why are you here? Why is this important? Tell them what you think. They want to hear from you. We also have a really amazing survey out there. I mentioned that a little bit before. It's the Colorado Workforce. That is also through our social media. I would really encourage you to fill that out. We're getting up to hundreds of people fill that out now, and it's giving us incredible insight. Again, what do PAs want? What is important to you? How can we represent you? And what are you feeling about your profession and where we need to go? And can you get a job in Colorado? And if you can't, we want to know why, because that's a huge issue. Huge issue. 500,000 people have left healthcare this year. We need people to stay and people to really take care of patients and for us to take care of you as well. So really, Kappa social media, Instagram, Facebook, we're getting up on LinkedIn as well. So the specific needs outreach are David Ortiz. He's District 38 in Arapahoe. So that's sort of that South Denver, sort of Santa Fe over to Arapahoe in that area. I can put up a picture of his district. He really wants to hear from PAs. He's really interested in what we have to say and why this is important. And he's making this decision right now on whether to vote for this or against it based on input from PAs. So we really need you to reach out to him. Kyle Mullica, he's the nurse that I mentioned who voted against this last year. He's up in Adams County, up in Thornton area. He needs to hear from us too. He needs to understand what PAs bring to the table. And he needs to also understand what would happen in this state with healthcare if PAs can't find jobs. We are everywhere. We provide unbelievable infrastructure of care. And Matt Soper, he's down in the Delta around Mesa, Colorado Mesa. He really could really benefit too from hearing from PAs in his state, particularly since he is in a rural district, which will be very adversely affected if this bill doesn't pass. All right. So Keys for
Um,
22, talking points. Yeah, here we go. Here's your thing, Cooper.
I know. I'm sorry.
So,
We go
this
back
is
to the
yeah.
slide for that.
What's that? Slide before? Yeah, go ahead.
Yeah. Okay. So joining CAPA, informing your colleagues, contacting your state legislator, filling out the survey, social media, all that is really, really great. We also would love to hear from you, right?
Oh, yeah.
We would love to hear how this bill might affect you, because you're going to be sending these letters from the template that we kind of have with the phone to action stuff and what we sent. But we would love to hear from you if you feel like you have a unique or niche area of practice as a PA.
Yeah.
We would love to hear about that, right?
Yeah. Yep. And I'll tell you how to do that when we at the last slide. I'll give you that information. Yes. Yes. Thank you so much for bringing that up, Cooper. I can't tell you how important it is for CAPA to hear from you. I really believe we have an open, well, it's not really an open door because nobody's together anymore, but it's an open email, open call me kind of situation.
Yeah, and
So
the feedback
yeah.
that we just did was huge.
Yep. So really, we want to hear from you. All right, key goals for House Bill 22, 1095, collaboration, strengthen the healthcare team, right? Whatever that team looks like, whatever's working for your team. We want to increase access to care. Right now, we have communities that can't hire a PA because they don't have a doctor. And if you don't have a doctor, you can't have a PA. We need to uncouple that. That's just doesn't work anymore. That's not where the supervision and the safety is coming from. And affordability. We really, really need to work on affordability of healthcare. I think we can all agree that certain aspects of healthcare just don't work anymore. And this is what PAs are trying to do to help fix this problem. Okay, so thank you. I really do believe this. I think PAs are just naturally helpful and kind people. And I think more bees with honey, right? We are just trying to help. We're just trying to make some real positive changes. We are not trying to do anything negative for any other profession. We're just trying to help our patients. So thank you so much. And there's our Facebook, our Instagram. You can just search Colorado Academy of PAs. We've got all kinds of stuff going on there. And then what's coming up? So CAP elections. If you would like to join us and have a lot of fun with some PA colleagues, our nominations will be opening soon, and we always have board positions available. Please think about joining committee, get involved, dip your toes in, come meet us. And our annual conference is in person this year. It's March 4th through 6th. It's coming right up. Registration is still open. There's all kinds of information on our website. It's going to be a really fun event and a really good opportunity to network, meet PAs, and spend time with us. And CAPA Awards. So every year we do a bunch of awards, and this year it was pretty competitive actually, but we'll be announcing those awards and those winners on March 4th at the membership dinner at the conference. So this is really important stuff again. So CAPA advocacy site. So our website has a bunch of information about how to get involved, what we're trying to do. The bill's linked there. Right on the web page is that email link for your legislators. And then I again put it here. That's the link for the legislators. And then as Cooper was saying, if you have a very unique, compelling story about why this bill means something to you, let us know. We can always put you in touch with our lobbyist, who is sort of putting the planning together for the testimony on Wednesday. Let us know. And if we do pass Wednesday, we're going to need even more support and even more help as we move forward to make sure that this bill gets all the way to being signed into law. So lots of information. So thank you again. And again, if you don't remember anything or you lost all this information, just email CAPA, info@coloradopas.org. That's right at the bottom of the webpage, and someone will get back to you. So please do that. All right, so I think I'm going to stop sharing, and then I would like to move to questions and kind of into the chat. So let me
Alan, I think we
see.
have
Yeah,
one question about
yeah,
liability insurance,
yeah.
and a question about, is this insurance covered by the practice, or are we required to hold this policy ourselves as individuals?
That is such a great question. It really does depend on your individual practice. I will say a vast majority of PAs in Colorado have insurance provided by their employer. That's usually in the form of either a rider policy, or you're in addition to the practice policy or to your physician's policy, but also an increasing number of large organizations like Centura, Kaiser, UC Health. They have a large group policy for their APPs, and typically those limits are in the 10 million type range. So those are very adequate. But there is nothing, as a PA with 22 years experience, I'll tell you, there is nothing more important than understanding the liability coverage that you have with your practice. So if you don't have your policy, first thing tomorrow morning, go get it, review it, make sure it's adequate. But per state law, and this has been state law for 3 years, and COPIC also was very involved in this legislation, you should be fine. You should be fine. And was there any other question?